Good evening, everyone. My name is Diaremes. I'm coming from Frankfurt. I will talk today about the results of our study in surgical site infections. I don't have nothing to declare. It is so that due to the demographic change, we see that the population is aging and more spine surgeries are expected in the future. One of the most severe complications of spine surgery are surgical site infections, and the problem is that that affects directly the patient outcomes and their quality of life, increasing morbidity. They also pose a substantial financial burden on healthcare systems, up to 3 times higher as the normal costs for the patients without any infection. According to this systematic review and meta-analysis, the overall incidence of SSI is approximately 3.1%, being at most with neuromuscular scoliosis patients at up to 13%, 13%, sorry. SSIs are more common in posterior and instrumented cases compared to anterior and minimally invasive cases. In our study, our objective was to stratify the risks and recognize possible protective measures to avoid SSIs. We had identified infections in a cohort of 6,400 surgeries between 2015 and 2020 in our clinic and matched age, sex, surgery type, as well as the quarter of our operation with patient without infection. There we had 153 pairs, and our cohort was 66 years old in mean, and mostly women, 2/3 of them. And we evaluated approximately 120 parameters, including endogenous and exogenous factors. And we performed non-parametric statistical tests for comparing paired samples, including the Wilcoxon test and the McNamara test, as well as univariate and multivariate regression analysis. Only variables with p-value below 0.1 were included in the model. What we found out is that what we also expected from the literature, that diabetes is doubling the risk of an infection, and also what we could not really, what was unclear was that the perioperative glucose level can affect an infection. What we also saw in this subgroup was that the patients with insulin-dependent diabetes mellitus were a lot more in the infection group. BMI was also recognized as a significant risk factor, as well as ASA score. And then we analyzed our preventive measures. The local application of antibiotics during surgery has shown to reduce SSI rates in our study data and also in the literature. In fact, spinal surgeries without vancomycin are 3 times more likely to develop infections. However, this approach must be balanced with the potential for promoting gram-negative agents as E. coli and Pseudomonas, particularly in gram-negative infections. We also analyzed the antibiotic use. Administering antibiotics up to 3 days postoperatively was associated with a significant reduction in SSIs in our study compared to the perioperative prophylaxis group and the 5 days group. And the skin closure was also significantly better with staples. Here the control group had a lot better lower infection rates. As a take-home message, the clinical implications of these findings are clear. Preoperative risk assessment and optimization of diabetes and BMI, and careful selecting antibiotics and surgical techniques is essential. For instance, using minimally invasive surgery and extending antibiotic prophylaxis in high-risk patients can make a measurable difference in reducing SSIs. And looking ahead, the development of a reliable risk calculator for spine surgery is a critical next move. Such a tool would help clinicians to quantify the risk, and a multi-center study would be very essential to validate this approach. I think the future lies in machine learning and clustering, as Ms. Baroncini said. Thank you.
Thank you
very much.